I am a doctor of chiropractic. I graduated from Parker Chiropractic College in December of 2005. And really, my main goal is to talk to people and patients in the community about upper cervical chiropractic. It's really a specialty within the chiropractic profession, and I'm very passionate about it. It's what actually changed my life, and just experiences that I've had over, now almost going on 18 years now. Just the miracles that I've seen is with this type of chiropractic is just astronomical. Probably the biggest healing story I can tell you is how I actually got into chiropractic. I was a chiropractic assistant. I can type 65 words per minute, and, I'm pretty decent on the phone. And so I started working for a chiropractor. I was 18 years old, straight out of high school. And through the years, I started working for different chiropractors, all different types of techniques. But when I started working for a chiropractor in Austin, Texas, I started seeing something different with the upper cervical work. And I'll show you here in just a moment the model. I actually brought one so you can see what the upper cervical complex is. But there was this little baby that came in, 12 days old. And what we found out is that she had a very, very difficult birth. Long hours in labor, and she never even cried when she was born. It was one of those things where they were just really scared that she wasn't going to make it. And after 12 days, she was having trouble with breathing. She was having trouble with even nursing. She couldn't even get a suckling reflex. She was very, very weak. And they found our office through, basically with the grace of God. They actually found our office, and they walked in. The doctor that I was working for at the time, he was about to leave, and I caught him at the last minute, and I said, "You got to come up here. This couple's up here. They look really desperate." And so we took this couple and their beautiful baby girl back into the exam room, and what I saw was basically a miracle that day. You hear about it all the time. It's not something we see on a regular basis, but it does happen. And so we did the exam. The doctor put what we call a thermography scan right up here at the very top here. And it actually looks to see how well the nerves are functioning up in that area, leading to all the different organs, glands, and tissues. And what they found, there was just nothing happening up in there. And what we do know is up in the upper cervical area, C0, C1, C2, is where the respiratory centers lie. The medulla oblongata is right there. And that's what controls our inspiration and our expiration of our breathing. And what he did was he actually did a further examination to find exactly which side to adjust on. And what happened right then and there was just amazing. Is he actually just used his pinky. That's all he used, is his little tiny pinky. And put it, just the pressure, like you would kind of, find like for a ripe tomato or something. And he put a little pressure right there, did a slight movement, and the atlas moved, or the C1 moved in the proper direction. That baby took a nice deep breath, turned bright pink from head to toe, and cried like a whale, like you want to hear at birth, right? You want to hear that happen. And we saw that child basically come to life right there on the table. And this is after, multiple times of going to doctors. Why is my baby not breathing properly? What's happening? Why is, she has apnea, basically, that the baby wasn't breathing properly. And so what was just so amazing is that baby, within the next week or two, became normal, breathing normally, eating normally. Everything happened on a normal basis. And so she was given her life back, and the parents have their brand new baby, a healthy brand new baby. That was when I decided to become a chiropractor. I saw that and I said, I just have to do more. So I actually became serious about going back to school. So that was probably the biggest miracle story, and we get to actually see so many come into our office that are sick and suffering, have been there, done that, got the t-shirt everywhere. They don't have a reason or a why as to, why they're suffering, why they're so sick, why they have a bag full of medicine and nothing's working. And so we take it from a different approach, a chiropractic approach, a whole body approach. And when it comes to the specialty that we do in our office, it actually comes from this area right here. So this right here is what we call the cranial cervical junction. So you'll have your brainstem right here. This is the cerebellum. This is the back of the head. So we're looking from the side here. And what you actually see is this first bone right here. This is the atlas. The skull sits right on top of it. This is where we get all of our movement. And so it surrounds part of the brainstem. And if it goes out of alignment, it can create a bottleneck in this area. Not just, pain or a problem, headaches, things like that, but it can actually cause problems that could affect the brain. And when it comes to that, when the atlas goes out of alignment, it can actually affect vascular issues. It can actually cause issues here in the vertebral artery. Also, there's the internal jugular vein that goes down in here. And it can cause problems with cerebrospinal fluid flow, not moving properly. So when we see this out of alignment and we see patients with dizziness, vertigo, migraines, headaches, brain fog, you name it, there's all sorts of things that can occur from that area, then we can extrapolate them. Possibly it is a mechanical issue. And this mechanical issue is something that as an upper cervical specialist, we can correct. That is what we aim to do. Now, sometimes that's not the case. Sometimes we do find patients on, a few patients that we do need to refer for other tests or work concurrently with a neurologist or their primary care physician or even a cardiologist. We'll work with any doctor. But what we do find is that if we correct this mechanical issue, that's when we start to see the changes in physiology. Now, I actually took 3 years to do what we call a diplomate program. I now have a diplomate in chiropractic and cranial cervical junction procedures. So DCCJP are the extra initials after my name. And it took me 3 years and 300 hours to do this course. But it was well worth it because now I have a true understanding of the role of the cranial cervical junction and how patients are able to heal, what's causing them not to heal, as well as I like to look into things like more concussion, traumatic brain injury, as well as post-concussive syndrome. There are so many patients out there that have been suffering for so long after having a concussion, some sort of traumatic brain injury, and they're not getting well. They've been cleared. They don't have any, lesions on their brain. They don't have any brain bleeds. They've been cleared by the neurologist, but they're still having, the brain fog, blurred vision, depression and anxiety even can come from that because of the balance issues they could have, the headaches, the dizziness, the vertigo. All those things come from post-concussive syndrome. And so those are some of the things that I'm really focused on and why I started just diving deep into some of the rabbit holes that I typically find when I do my research. So that's kind of where I'm at right now. And one of the studies that I'm most interested in at the moment is what they're calling the Denver study. And this Denver study is looking at how patients with long COVID also have some neurological issues, but they're connecting it, which I find so interesting, with those that had a previous concussion that are coming up with more of these neurological issues that come with long COVID syndrome. So with the Denver study, as I mentioned, what they're finding is that they're finding that those that have had a previous concussion, especially those that have more than one, that they are finding some links between those that have had a concussion and those with the neurological issues of long COVID. I'm sorry. They're finding that they're having almost the exact same symptoms. Strikingly similar. They're having the anxiety, the blurred vision, depression, anxiety, memory and cognition and concentration issues. They can't sleep. Dizziness, vertigo, headaches, things like that. So those are all things that are very much the same as it is with post-concussive syndrome. So that kind of piqued my interest there. I was like, okay, well, this is something that I see on a regular basis. This is something that I've been trained to look at. and trained to use upper cervical chiropractic to help these patients get through these issues. So they're looking into that. And again, it's an ongoing study, so there's not much really to go on at this point in time, but I'm following it as closely as I possibly can. What they're also seeing now, this is kind of an update that I found, was that there's a type of sideline type concussive test that they can do. It's like a 2-minute test that they can actually do. It's through the Mayo Clinic. It's actually called the King-Devick test. And basically what it does is it uses basically it's kind of hard to see here, but what you want to do is kind of test the way a person's brain is working after a concussion. And it looks at the saccadic movements of the eye and how they're tracking numbers. So they should be able to do this test. A healthy brain should be able to do this test. I've read anywhere between 42 and 54 seconds. So if it's any longer than that, they're having trouble tracking. And when they're having trouble tracking, what that means is that their brain is not functioning as fast as it should, and they should be taken right out of the game. Now, with athletes, they actually have a baseline prior to the season. So if they're off by about 5 seconds, that means they should be taken out of the game. Now, with these long COVID patients, of course, we probably don't have a baseline unless they're also an athlete at the time. But what we're seeing now is that there is definitely some correlation as to this particular test, and should a patient have long COVID syndrome, or the likelihood of them having long COVID syndrome. So it's one of the tests that they're actually looking at that is, again, concurrent with what we're seeing with that connection between long COVID syndrome as well as post-concussive patients. So again, this piqued my interest even more. What we also know is that a traumatic brain injury can also impact the gut. The gut is something that it's called the enteric nervous system that lies within the gut. You can't take away the brain and the gut. The brain and the gut are so connected that when one gets injured, another gets injured. You can even extrapolate from other studies of the microbiome that if you have a bad gut, you have a dysbiosis or more bad guys and good guys in the gut, then you can actually have some depression, anxiety, things like that. That's where they're using a lot of probiotics right now to help these patients with long-term depression and anxiety. So that's something that has been accepted in the medical field, which I think is really amazing. But now we're seeing with head injury, we're actually seeing the opposite. It's actually affecting the gut. So now they're taking this information and they're linking this with now long COVID, because we know that those that have COVID have gastrointestinal issues. That was part of the sequela that was actually occurring during this time. But also long COVID patients are also having continued gastrointestinal issues as well. On the flip side of that, we also know that having a traumatic brain injury, a concussion, especially more than once, affects the blood-brain barrier. So that means that blood-brain barrier that's meant to keep all those bad guys out of there and keep that space nice and clean and clear, it gets compromised during a brain injury. So what we're actually seeing now is we actually have a study. I'm going to go ahead and kind of look this study up because I want to get the journal correct. The Neurobiology of Disease Journal of December of 2020 actually showed that the spike protein, this is quoting from this actual study, the spike protein triggers a pro-inflammatory response in brain endothelial cells that may contribute to an altered state of the brain-blood barrier function. So, and where they're actually saying this connects and where they're saying that it actually affects the most is the frontal cortex. So with that said, the frontal cortex it's where we have all of this is who we are. Our frontal cortex is where our major decisions are made, where we have our personality. That's who we are as our frontal cortex. And typically around the age 25, 30, it fully matures. And at this point, what we're also seeing is that where anxiety and depression comes from is also when the frontal cortex is injured or damaged. So they've made this connection within the literature. And so now they're seeing some of the same things. Again, concussion actually can cause this, as well as long COVID symptoms. We're seeing this. So there is a connection with that within that blood-brain barrier that we're seeing. And so if chiropractic can help clear out that blood-brain barrier, that is can clear out the brain and kind of clean it out and kind of lock up that area a little bit. That could be, what I'm trying to get at is I want to see how upper cervical chiropractic can be a team player in this. We know that COVID in and of itself, just the actual infection itself, is multi-layered. There's so many different symptoms that can happen, and not everybody has the same symptoms. That's what made it so crazy at the beginning, because nobody could actually tell us, okay, I mean, basically every symptom is a symptom. So I think it made everybody a little bit crazy. So when we're looking at now this connection between a post-concussive syndrome, all these symptoms, and the fact that patients with long COVID have these same symptoms, maybe we can look at some sort of common ground as to maybe this upper cervical area right here could be playing a role. So what I would like to kind of talk a little bit more about is, how does upper cervical chiropractic help the flow of cerebral spinal fluid in the brain, to help clean the brain out, to help heal the brain? And so what I want to do is kind of talk about, there is it's called Intech Open. Basically, it's an open forum for medical books. There's this one called Hydrocephalus, and one of my instructors, actually two of my instructors, Dr. Scott Rosa, who's a chiropractor, and Dr. David Harshfield, who is an MD. They got together along with a couple of other doctors, and they created this chapter in this book, Hydrocephalus. And what they're talking about is the structures of the cranial cervical junction, the CCJ, C0, C1, C2 in this particular area, and how when the atlas is misaligned, so if this bone right here becomes misaligned, how it can actually affect the flow of cerebral spinal fluid flow, as well as the vascular function in there. You do have your vertebral artery that comes, this is what that is right there. It actually is right here. It actually comes up and creates what they call the circle of Willis, which is right here. And that goes up into the brain to send blood and oxygen to the brain. But you also have the internal jugular vein that comes down, and that helps clear out old cerebral spinal fluid. You make 500 cc's of cerebral spinal fluid in your brain every single day. It flows around the brain. It helps keep the brain buoyant and healthy. It clears out the brain. It sends nutrients to the brain. It's so important. It comes all the way up, goes all the way down your spinal cord, comes all the way back up, and then leaves. So it needs to flow freely. It actually pumps every single time your heart beats. So it's one of those things that, you don't always hear about and how important it is, but it's really important for nervous system and brain health. And taking care of the most important system of the body that controls everything, I think, is the foundation to health. And that's what I get to see every single day, change in people when we actually see their atlas holding. We don't have to adjust it every single day. And we're seeing the change in their lives. They get to talk to their primary care. They're getting off medications, and they're seeing their lives change. And it's just a privilege to be a part of that. And when I see something like this, such a great catastrophe that has happened after almost 3 years now, and there's so many people that are still suffering after the virus is out of them. They're gone. They've got antibodies, they have T cells working, but there's still something that's not quite right. And the spike protein we know causes vascular issues. That's what's causing the inflammation. This is the primary component. There's multiple studies in the literature that actually show this. But what happens when it gets past that blood-brain barrier? Just like any other virus, it can actually wreak havoc. And is that what is happening? And how can creating better cerebral spinal fluid flow, opening up this gateway, I call it the master breaker up here, the nervous system, how can that actually help? Why can't upper cervical chiropractors be a team player in this amongst the other doctors that could be on their team to help them get over this process? I'm so excited to kind of share this with you, because the more I dive into it, the more I know that we can be an active player in this, doing what we do best as chiropractors to remove the interference at this level to help the body heal itself. And that's essentially what we do. As chiropractors, we don't treat diseases. We don't do any of those things. But what we do is we make sure the nervous system, the system that controls everything, can help the body heal from the inside out. What we like to say is from above down and inside out. That's the basis of what chiropractic is all about. And upper cervical chiropractic really, for me, is the epitome of that, because that is truly where I think, it's the most neurologically dense area of the nervous system. I mean, that area controls all your breathing, controls all your heart function, but it also controls all of your posture muscles. So we actually even get to see changes in people's posture, changes in people's blood pressure. I mean, immediately following an alignment, there was a study that was done. Now it's got to be at least 15 years ago that was done, that showed changes in people's blood pressure after an Atlas alignment. Up to 14 points, their blood pressure would go down after an Atlas alignment, and it would stay that way without any drugs. So that was actually done, like I said, at least 15 years ago. Through a cardiologist's office and an upper cervical chiropractor. They teamed up to do this study. So I thought that was pretty incredible too. So again, there's so many different facets. I could go on and on and all day about this, but that's the primary reason why I wanted to kind of go over this, is because I think there's a missing link. I do think there's a mechanical issue that's occurring here, and I think this Denver study is going to open that wide open. That, not every single long COVID patient has the same symptoms. They have, like I said, just COVID in general runs the gamut on the symptoms that anybody could have. Some people have a sniffle and others have major neurological issues. Why is there such a difference? So I'm really anxious to see where this Denver study goes. I'm anxious to see, if there's anybody that I can help in my area. I'm in Plano, Texas. I'm north of Dallas. And I truly hope that, through this medium as well as others, that I can actually get through to people and say, there's no reason for your suffering. If I find, a misalignment in this area, it may not be the only thing that is occurring with you, but if there is a mechanical issue, an upper cervical chiropractor is the only one that can handle that. The only one that can remove that interference very gently, very specifically. And the precision really here is key. And to do the diagnostics before and after is really key as well, to make sure that these patients are chiropractic patients and that is the problem that they're having. So, in our office, we don't even adjust on the first day. We do specific diagnostics to make sure that patient is in the right place, that, first of all, we can help them, that they do have a misalignment or subluxation in this region. And if so, exactly how do we need to correct it? And, our technique is called orthospinology. There's many techniques under the upper cervical umbrella. And when it comes to healing, all these different techniques, they all go for the same thing. They all want to make sure the atlas is in the proper position, and healing can then take place. But we even do post films to make sure that we move that bone in the correct position. as well as post scans that we do. We do thermography, we do surface EMG, we do heart rate variability. We look at posture before and after. I mean, that there's a real change when that happens. And, when patients really see that there's an actual change, they can see and they can feel the difference. And with that first adjustment, it is so powerful. And that smile they have on their face, like what just happened, it was just such a light little tap here. What happened, and that smile they have on their face, I can tell you right now, Francesca, it never, ever gets old, because they have been everywhere. I mean, a lot of times they show up on our doorstep, and we're their last hope. They have no other place to go. And if we find that, what they have going on is a chiropractic and upper cervical misalignment, then I know we can help them. I know for sure that we can help them. And in these cases of long COVID, they're desperate at this point. They're desperate because they're really not getting any help. And these studies are very, very slow. And if I just can take what I do know about post-concussive syndrome, about concussions in general, and take that 300 hours course, that diplomate course that I took, and give them that hope that they need, I mean, that's all they need to start the healing process. Hope starts the healing process. And it's just a privilege to be able to work with these people. This is the latest, the latest numbers I've gotten, is there's about 1,200 of us that practice in America and Canada. So it's a small there's over 100,000 chiropractors, we're looking at here, and only about 1,200 of us practice this particular technique. So we're starting to grow that. And as far as the diplomate program that I was in, as far as those that have the diplomate in the upper cervical work, there's less than 100 of us. So we're trying to grow that part of the profession. It is more difficult. There's more study. There's special equipment. There are the x-rays that we take are precision x-rays. So, it takes a while to actually learn how to do those. So it does take extra time. And there's only so many schools that actually teach it. I know Life University in Georgia, in Atlanta, Georgia, they teach upper cervical work. Sherman, which is in South Carolina, they are, I would say, one of the best at the moment. I have a couple of my colleagues from the diplomate that actually teach there. So I'm really proud that, anytime I have anybody that comes to me that says, hey, I want to be a chiropractor, said, you have to look at Sherman, even in Life University, because they are really teaching this upper cervical work beautifully. And so those are the two places that I suggest going if you want to become a chiropractor. And speaking to the chiropractors out there, look into this. We need more of you out there. There's so many sick and suffering people. And throughout the years of being a chiropractic assistant and up through being a chiropractor, this is where I've seen the most change in people's lives. So, to answer your question, probably most chiropractors you meet are not going to be doing this specialty, because again, when I say specialty, I mean specialty. And very few of us do it, but it's amazing. The changes that you see with just this gentle, specific vector-based adjustment. It's amazing. There's over 200 different techniques in chiropractic. So when you're looking at chiropractic in general, a lot of people think just like that it's the heavy rotation movements. And I have to say, there's a chiropractic technique for everybody. And some people do like those rotary movements. They like to hear the popping, the clicking, all that stuff going on. Those are very effective. And in the hands of a skilled chiropractor, they are very safe. We're talking 1 in a million chance of something going wrong. And there was even a study that was done not too long ago that showed that you have the same chance of, they talk about strokes, some of the things that they're talking about. You have the same chance of having a stroke going to your primary care physician that you do with a chiropractor. And, I look at it this way. When it comes to the safety of chiropractic, let's look at malpractice insurance. I think that's probably a really great way to look at things. Malpractice insurance for your GP, runs about $15,000, $10,000 to $15,000 a year. That's average. It could have changed up to this point in time, but the last time I checked is several years ago, it was around that amount. And then you're looking at probably some of the highest are anesthesiologists and OBGYNs, and they're in the hundreds of thousands of dollars per year. And what do insurance companies base those numbers on? That's a huge gamut. You've got your general practitioner and all the way up to your OBGYN. You've got, tens of thousands of dollars of the difference. Well, that's based on risk, right? The risk of that patient, their patients either, getting injured. So when you look at chiropractic malpractice insurance, you're looking at risk as well. All chiropractors, that have, malpractice insurance, as we should, they are looking at anywhere between $1,800 to $3,000 a year. So that's a huge difference. Typically in a family, even at the highest, if you have the highest rates, because, you have maybe $3 million in malpractice insurance or something. That's how they depend on, the rates. They take the rates. Is that a lot of families right now are paying that much to drive their car. So it's, driving to the chiropractor is more dangerous than getting a chiropractic adjustment. So that's one of the things that when I talk to people and they're scared, the precision that we use in our office, we don't do any of the rotary movements, and not that we believe that they're unsafe. We just don't think that they're necessary because of the upper cervical work that we do. When we move the atlas, the postural muscles that are controlled there at the brainstem, they respond and everything relaxes. You can actually see the entire body relax. One of the first neurological signs we find that show that there's a misalignment at the upper cervical area at the atlas is a short leg. So one leg appears pulled up or short. It can be up to 2 inches. I've seen it that short before. And it's not that it's an anatomical short leg. Actually, for the most part, that's pretty rare. But what we're seeing is we're actually seeing more of a functional short leg. So when the atlas goes out of alignment, it sends the wrong signals to one side of the body of those postural muscles. So it actually kind of causes more of a muscle spasm on one side. And so it kind of torques the hip up and it lifts that leg up. So you actually see what looks like when they're lying on their back, one leg shorter than the other. So that's one of the first things that we find is that if the atlas is out of alignment. Then when we adjust the atlas in that very specific way, using the listing, we actually get vectors off of their film. And we have an instrument. It's called a Laney KH2 instrument. And it basically just puts a tap right here or on the other side, depends on what side the atlas shifted to. And what we do is we adjust it, and then immediately we have them stand up. Their hips become nice and even, and when they have them lie down, their leg lengths become nice and even. So we know we got a good alignment there. So those are some of the neurological things that we see immediately following an atlas alignment. So it affects the whole body. It affects the way the person stands up and sits and holds their head. You can actually see before and after pictures of the body change when it comes to having the atlas aligned. It's pretty amazing. And again, like I said, it never gets old to see that smile on a patient's face when they can move better. Their neck is no longer stiff and sore. I actually feel the neck prior to the atlas alignment. It's just really tight and taut, and you can actually feel even a nodule here around C2 that's so tender. And after that alignment, I just sit them right up and I feel their neck, and it's just soft, it's supple, it's kind of like marshmallows. And they're like, wow, I can't believe that. That's that little thing. It didn't feel like it even did anything. And so that again, every time I see that, I can't wait to see it again. Each and every patient is a little bit different, but that smile is exactly the same after that first atlas alignment. Autoimmune diseases, they typically start in the gut. And that's something it's in the literature. You just know that there's some sort of gut issue because that's where the majority of our immune system lies. Now, as a chiropractor, I don't treat diseases, I treat the person. So no matter who comes into my office with whatever autoimmune disease that they actually have been diagnosed with, my main priority is to make sure the nervous system is functioning properly. The nervous system is a system that controls everything. It controls the gut. It controls the immune system, cardiovascular system, endocrine system. It controls all of that. So as a chiropractor, my goal is to make sure the most important system in the body is functioning properly. Because if the most important system of the body, the nervous system, is not functioning properly, is there any other system that can function normally? And the answer to that question is absolutely not. So as a chiropractor, my goal is to treat a patient's nervous system, to make sure their neuromuscular skeletal system is functioning properly so they can adequately heal from the inside out. Now, supporting their system with nutrients, that's always, a thing. Any sort of autoimmune issue, I recommend patients to get on the autoimmune paleo diet, to make sure you take out some of those foods that can be destructive during an autoimmune issue. Your nightshades, for instance, that's probably one of the biggest ones that, patients go, really, I can't eat peppers anymore. Well, maybe you can later on, but for now, we need to make sure the inflammation goes down in your body so your nervous system can heal, your nervous system can help your immune system function more normally. So as a chiropractor, to answer your question, I want to deal with the foundation of how the body functions, and that is the nervous system. So from there, we can build on detoxification programs. We can build on proper nutrition, get the junk out of people's diets. I mean, for the most part, most people don't even know what real food is anymore. So that is one of the biggest things that I try and teach patients is, to how to eat real food. And that's healing in of itself, because a lot of times our gut microbiome has just been destroyed by things that are in our food supply right now. So just educating patients on eating properly, I think is well within the scope of what I like to kind of help patients with. And, but primarily it's just making sure that nervous system is functioning properly from above down, inside out. So the organ reflex exam uses Chapman reflex points. Now, this exam, it doesn't uncover any diseases, of course. What we're actually looking at is how are we going to determine what organs or glands need nutritional support? So, when we go into the process, I tell the patient, I say, I'm not here to diagnose any disease. What I want to do is I want to check and see if there is any struggle within these organs or glands. So Chapman reflex points are areas on the body that are associated with different organs and glands. They're areas of lymphatic tissue. And what Dr. Chapman found, I think it was back in the 30s, he actually found that these particular reflex points, these areas of lymphatic tissue, can become tender if that organ or gland that it's associated with needs a little more nutritional support. So what I do is I check these particular areas, like say, for instance, right here, there could be a little sore spot right here. Okay. And this corresponds to the liver. So this is that liver Chapman reflex point. It's on the right side over here. And I ask the patient, I say, okay, tell me if it's sore. And if it is, I want you to rate it from 1 to 5, 5 being the worst. But if there's no soreness, you can also say 0. And so they give me a number, they say 4. Well, okay, that's pretty tender there. So then I have multiple supplements that I have, that I use, and I have them taste a supplement. Now, this is not the most wonderful part of the exam because none of these supplements really taste all that great. But what we're using is what we call a neurolingual response. So when I put this, supplement on their tongue and they taste it, I go straight back to that point and I ask them, did it get better? Did it get worse? Or was there no change? Those are the 3 things that can actually happen. But the majority of the time, if we pick the right supplement, it will get better. Like it'll go to 0, 1 or 0, barely even sore. And that tells me that supplement is what's going to help support that system, that organ, that gland that may need some nutritional support. So from there, I put together, and I check all the other areas. And from there, we put together a comprehensive supplement program. Our goal is not to have them on 40 different supplements for the rest of their life. Our goal is to have them on a good whole food multivitamin, to have them on a omega-3, as well as to eat their probiotics. I want to teach them good, rich probiotic foods to eat. And that's really the basics right there. And also eating the right foods, getting the junk out of their diet to help them, just feel better overall, and to help them teach them what real food actually is. That's a huge part of what we do in our office, to help ease the inflammation that could be related to a lot of the back pain and headaches and things that we see constantly in our office. So from there, we'll check again in 4 weeks, and we'll see how these areas have changed. And the majority of the time, within 4 to 8 weeks, we see significant changes in the areas, so much so that they get to be put on the basics, which is, again, that whole food multi, the omega-3, and either some people prefer a pill probiotic, but a lot of the times, I think eating is more fun than taking a pill. So I school them on how to find good probiotics that they like. So that's essentially the Chapman reflex points that we use in the organ reflex exam. And it's a good baseline to kind of help patients reduce the inflammation that could be causing a lot of referral pain to like I said, the back pain, the headaches that we see every single day. That is a pretty big thing we've got going on here. I really think that the food industry is out to kill us. And I don't say that lightly. And do I think they're doing it on purpose? I don't know. I like to think the best of people, but when I'm looking at a label and I can't recognize anything that's on it, maybe a couple of ingredients. To me, that's not real food. If you can read a label and not recognize what's on that label, your body can't either. So what's happening is that first of all, we don't know what real food is. We don't know where to find real food. And when we go to the grocery store, we're just looking for something that's fast and cheap. Well, fruits and vegetables actually can be really fast to cook. And a good quality protein also is important. So when we're looking at, say, proteins, okay, to me, I think protein is very important. I may, anger a bunch of, vegetarians and things like that, but I do believe that we do need some protein, and particularly animal protein in general. But the thing is you can't eat a sick animal and think you're going to be healthy. So yes, there is a lot of beef out there that is not healthy for you. The big, like you said, the commercial farms, the CAFO farms, these are sick, horribly sick animals. They're kept in deplorable, conditions during their life here. And, they're just not a healthy food to eat. So I would say, yes, do not eat that. But if you can find a farmer that's close to you that practices proper animal husbandry and feeds their animals what they're supposed to eat, like cows, they're not supposed to eat grain. Their stomachs were not built to digest grain. That they eat grass and hay and alfalfa and those things. That's what's going to make a healthy animal. That's what's going to, they're grazing, they're in the sunlight. That's what's going to make a healthy animal. And, when they're sacrificed for us, for our health, that really helps our bodies heal. And when it comes to, your fresh fruits and vegetables, even frozen's healthier than canned. So if you can't get fresh fruits and vegetables, frozen is just fine as well. But they're quick and easy to fix. And you don't have to buy everything organic. It'd be nice if you could, but not everything in your grocery store is going to be organic. You can't find everything. One of the places that would be really helpful for people out there to find good, healthy, organic food, or to know what you have to eat organic is the Clean 15 and the Dirty Dozen. So it's ewg.org is a great reference for them to go to. There's even a little app that you can look at and it'll pop it right up. Every year they put out a new list of the Clean 15, which you can purchase conventional. These are mainly clean. They don't have a whole lot of pesticides on them. They put them on there for you. So if you can't find them organic, you can feel confident that buying them conventional will be safe for you. Then if you really want to look at the dirty dozen, these are things that you must buy organic. In our family, if strawberries are not organic, they do not come into our house. They are riddled with so many pesticides that it's just not even worth eating. And they got a thin skin, so it goes deep into that strawberry. So washing them is not going to help either. You mentioned glyphosate. Glyphosate, which is the active ingredient in Roundup, now in litigation has been shown to actually cause lymphoma in those that use Roundup. So we know this. There's lawsuits. There's billion-dollar lawsuits out there. So I'm not saying anything that nobody knows at this point in time. But what glyphosate does, it actually causes damage to your gut. If you've ever heard of leaky gut, it's one of the major contenders out there. Leaky gut, by the time you're 2, you should have we call tight junctions in the gut. They should be very, very tightly wound. The digestive system should be a closed system. Only some molecules can get through during digestion for energy and things like that. But once it gets to the gut, you want it really tight and closed. You don't want any large molecule proteins to actually pass through. So that's why the gut needs to be nice and tight like this. But things like glyphosate, as I mentioned, NSAIDs, your ibuprofens, Advils, things like that. Some vaccines as well, because they do contain antibiotics in there as well as antibiotics and steroids. All of those can wreak havoc on the gut, and it kind of depends on the person. Not everybody's going to react the same way with these particular offenders. But what happens is it causes what they call a leaky gut. So now you have holes in the gut, okay, for lack of a better way of saying it. You have holes in the gut. And when you have holes in the gut, large molecule proteins from foods can get into your bloodstream. The immune system does not like any proteins other than self to be in your bloodstream. The immune system goes on high alert. And what does it do? It goes to those proteins and creates antibodies to those proteins, and an inflammatory response ensues. So if you're always eating these foods, like say, for instance, gluten, okay? The more you eat gluten and the more these antibodies start to attack, the more inflamed your body is going to become. So the more inflamed your body becomes, the more sick you feel, the more tired you feel. And that's what we need to do, is we need to look at how are we going to heal this gut. So one of the tests that we do is called an IgG test. It's a food sensitivity test. What I love about this test is, number one, it tells you if you have a leaky gut. If anything shows up as a high antibody response, we do know that you have a leaky gut. That's number one that it says. Number two, it says what proteins are getting through. So, you've got your gluten. The ones I see the most are dairy, gluten, eggs, and surprisingly, we do see a lot of some nuts as well that are in there. This doesn't mean you're going to have an anaphylactic shock. This is not an allergy per se. It is a sensitivity to these foods that creates an underlying inflammatory response. It's kind of like the embers of a fire that just constantly burn and never get put out. So it always it can cause intermittent pain. It can cause headaches. I mean, you can have gluten on a Monday and have a migraine on Friday. So they're really difficult to kind of connect the dots there. That's why this test is so important, because it allows you to kind of see on paper in full color what foods are getting through the gut. Now, what it is too, it's also the foods you're probably eating the most of, because it gives more opportunity for these large molecule proteins to get through the gut lining into the bloodstream, and therefore, cause problems in those areas, and cause an antibody response and that inflammation to occur. So we do that testing as well, just to kind of see, we don't jump at everything. We like to do things a little bit step by step, because not everybody needs that test. A lot of times you just need a few nutrients and symptoms go away and everybody's happy. But when it becomes a little bit more difficult, like they're still struggling, this is when we recommend the IgG food sensitivity test. And it really helps the patient kind of wrap their head around things that they need to avoid for a little while their gut is healing. And then we can slowly introduce those foods back in, because the good news about this is that if your gut heals, you can start eating those foods again. But we also teach them how to choose the right form of those foods. So you're not going back and eating all the hormone-laden, dairy or the glyphosate-full, wheat. So it is definitely something that we try and teach our patients on a regular basis so they can make the right decisions. It's something that doesn't happen overnight. It's almost relearning everything in order to get them to where they need to be. So it is a process, but it's fun, and it's fun to see patients recover and tell their doctor, too, that, I'm feeling so much better. I don't need these medications. And their doctor says, great. That's awesome. I love it when they support them as well. And I love working with a lot of medical doctors too, because when they see what we can do together, it becomes really empowering for the patient. And the patient is the one that matters the most here in this situation. In our stomachs have to be super duper acidic. I'm talking like burn a hole in the carpet acidic. And when it comes to, especially as we age, we lose the acidity of our stomach. Our stomach acid, our pH starts to become more basic. So in order to absorb, you were mentioning minerals, minerals need a very, very acidic environment in order to be absorbed. So if we're looking, say, with a senior citizen with osteoporosis, a lot of times I find them on proton pump inhibitors, or just take antacids because they have acid reflux. So what we like to do is kind of educate patients so they can talk to their doctor and say, hey, doc, I'd really like to try and get off these medications. And I would say 9 times out of 10, the doctors are very supportive of helping them get off of them. So again, we work concurrently with their prescriber to make sure that we're providing the nutrients that they need to be able to absorb the nutrients, because what we see is a lot of these senior citizens are coming up with the osteoporosis. And one of the main side effects of these antacids is osteoporosis, because they're not absorbing their minerals. They're not absorbing, their bone builders. So that's one of the side effects of these antacids. And so when we have them talk to their doctors about, weaning them off these, because you can't get off of them cold turkey, it really creates a big problem. So we have them talk to their doctors and make sure that they're going to be starting to get off of these on a slow basis while we add in the nutrients that they need, particularly hydrochloric acid. So there is a product that we really like. There's 2 companies. One is called Standard Process that has a product called Zypan that is excellent. It's a food grade hydrochloric acid, bentane HCl, and that creates the environment in the stomach for these minerals to start absorbing. Also, B vitamins need a very acidic environment. So you have people that are sluggish. They can't fall asleep and they can't wake up. I mean, it's a vicious cycle. The B complex vitamins, the only place that they are absorbed is in the stomach lining and a little bit in the small intestine. And both those areas have to be acidic for absorption. So in order to create that, again, the Zypan from Standard Process, or Thorne has one called Peptiguard that works beautifully for this, very gently as well, because, these are some things that they've had like some sort of ulcer or something like that. You kind of have to stay away from it, work with their doctor to slowly wean them off the medications that they have so we can slowly introduce this while their stomach is healing. And so when we look at people not absorbing things, it's typically starts, I like to say we got to fix north before we fix south. So fix the stomach before we fix the gut. Because what happens first in digestion, it happens in the mouth, then it goes to the stomach. And if the stomach is not able to digest food properly, it's not going to go through the gut properly either. So then that's where we get dysbiosis, we get, constipation, diarrhea, the whole IBS symptoms and everything. So if you fix north first, the stomach level, then we can actually, south sometimes fixes itself. So this is typically what we see sometimes. So it's really interesting to see how some people, their diet all of a sudden, changes and their health changes, and then eventually they don't have to take supplements or even medications anymore. So it's empowering to the patient that they can heal. It doesn't happen overnight, unfortunately, because it's been decades that they've been going through these processes. But when it does happen and they see the changes take place, it's really empowering because it's the less they have to rely on medications and supplements. Neither I want people to take for the rest of their lives. I want them to get the majority they can from food. Unfortunately, our food supply isn't adequate anymore to do everything, but just the minimal amount of a good whole food multivitamin as well as omega-3s that we need so desperately. Because our fish supply basically is also polluted. So we need to add in those essential fatty acids and to find really good ways to get their probiotics to kind of just nourish the gut with those good guys. We love seeing mamas come into our office, and I can't imagine, having another child without chiropractic. I can't imagine women do this. And what's so wonderful is OBGYNs are so supportive of, we have OBGYNs that fully support their patients coming in to a chiropractor prior to delivery. It makes their delivery much easier. It makes their job easier. So think of it this way. The atlas misalignment. I talked earlier about how the atlas surrounds the brainstem, and that's the area that controls postural muscles. So when the atlas goes out of alignment, it causes a muscle spasm on one side and it kind of torques the hips. Okay. We don't walk like a penguin. We walk like this. And so when the hips kind of torque like this and pulls up that leg, and it actually causes the uterus to actually become smaller and torqued as well, because the uterus is suspended in the pelvis by round ligaments. So what happens is when that pelvis is torqued, it doesn't allow the baby as much movement, especially by 35 weeks, when that OBGYN, that midwife, that doula, they're all looking for a head down, right? Otherwise you have a breech baby. So first of all, I want to make sure the atlas is in alignment. And what happens when that atlas is aligned is that hip comes down, that pelvis untorques, and it basically makes a 600 square foot apartment for that baby into a mansion. So baby can flip. So typically we look for that first. Now, if there's any other reason why baby hasn't turned, typically we actually see, pregnant mamas come into us towards the end of their pregnancy because their OBGYN or their midwife is worried that the baby isn't turning. So they look to see, okay, is there a cord wrapped? They make sure that there isn't anything going on there first, but then they send them to us. And what we do is we check atlas. Always want to make sure that's first, untorque those hips. But sometimes there's just a lot of musculature in that area that needs a little extra help because it's just been that way for so long. So what we do is we first check, we have them lay on their bellies. We actually have special pillows that little baby kind of sits in so they can actually lay on their bellies. Oh, mama loves that. So she can lay on her stomach, and we actually check the legs. We bring the legs up. We kind of just bend the knees up towards the buttocks. And if one is not moving quite right, then we know there's some issues there. So that's where we adjust the ischium, which is the very bottom of the spine. It's what you sit on. Basically, it's the part of the pelvis that you sit on. The hamstrings attach right to it. So we adjust that area first, and then we turn them over, and typically it's the opposite side round ligament that we need to adjust then as well. So typically what we do is we kind of dig into, it's like right in the hip area. And what we do is we release that as well. So once that's released, the ischium is released and the atlas is in alignment and the pelvis is in alignment, then we typically see in about 85% of cases, about 85% is what the Webster technique is successful, that baby then flips. Now, does it happen right away? No, I've never seen that before. But typically within a week or two of doing this particular technique, if it's indicated, baby does flip. So if it doesn't, then obviously, that's something that they need to take up with their midwife or their OBGYN. But like I said, an 85% success rate isn't bad when it comes to women that are wanting to have a natural birth. They'll do anything. And that particular technique is, again, it's gentle, it's effective up to 85% of the time. So the Webster technique is very successful in helping these women. But when their hips are not feeling great, they're not feeling great during pregnancy either. So allowing the hips and the low back to relax as much as possible, an upper cervical alignment, as well as working on those hips and the lower back, is just blissful to mom. And that sciatic pain they have, there's all sorts of fun stuff that happens during pregnancy that nobody ever tells you about, but we're here to support them as well. And gosh, we love our mamas. Oh, and we get to see the babies afterwards too. So that's even more fun. One of the best ways to get probiotics is from fermented foods. Now, some patients, especially with autoimmune issues, probably shouldn't go this way, as far as, like, say, your kimchi, your sauerkraut. There are lacto-fermented pickles, carrots, things like that you can have. For the most part, people can actually get some pretty decent probiotics, very rich probiotics from those. Several different species, looks great. Kombucha is actually another one as well. I prefer brewing it on your own. The ones they have on the shelves, a lot of times they're full of sugar. You can find some good ones out there, but brewing it yourself is super, super simple. And you can get some good probiotics from that as well. As far as yogurt is concerned, some people can't have dairy. There's coconut yogurt out there that I think is excellent as well. So there's many different things that you can get probiotics from. And actually it's kind of fun. I remember there was a point in my life where my kitchen was a lab. I had sourdough going. I had lacto-fermented carrots and pickles. I had water kefir. I had kombucha. I made a gallon of yogurt a week. I was really experimenting, kind of see what I can do, what I can keep up with. And it was a lot of fun. We made a lot of good foods and a lot of probiotic rich foods in our kitchen. So that was a really fun time to kind of experiment with those things, and basically how easy it was to do. But you can get some of these from your grocery store. You always want to look for organic. And not all pickles and sauerkraut and kimchi are the same. So you always want to make sure that in the refrigerated section, one of the brands that I like that you can find in a lot of places for some lacto-fermented pickles and sauerkraut is Bubby's brand. It's Bubby's brand pickles and sauerkraut, and it's only the dill pickles that are lacto-fermented. But those are they taste just like dill pickles. There's nothing different about them, but what you'll see is the water around them is a little bit cloudy. That's where all that wonderful probiotic rich liquid is. So you can eat pickles, you can drink the juice. Sauerkraut, the sauerkraut they have is also excellent. It tastes fantastic. So that's a great way to get your probiotics from food. Now, prebiotics comes in the form of fiber. And foods like avocado. Avocado is super high in fiber. It's the one fruit that is the highest fiber content, as well as a really good fat content to help curb your blood sugar, to help keep it nice and steady. So, half an avocado a day is fantastic for you for that. Also, Jerusalem artichoke is a great form of inulin fiber, which again is your prebiotic. It's easily digested. And so you can get it in a powder form, you can get it in pill form. You can put it in your smoothies. There's very little taste to it, so it's not something that will kind of mess up your smoothie if you want to put it in there. Standard Process has a really great, what they call whole food fiber from beets, which is excellent. Again, a lot of patients use that to put in their smoothies in the morning because it's a quick and easy breakfast. You can get a lot of veggies and fruits in there along with that fiber. So eating those types of foods, I think, is so important, not only for our health, but for the health of our microbiome, our gut. That's where so much of our health comes from. And I really think we're just scratching the surface in the literature right now as to how much the microbiome plays into just our lives, our immune system, how it plays into our mental health as well. So, they've connected, things like depression and anxiety with not having a healthy gut. And So, I mean, again, all that's in the literature. I mean, you can look that up yourself, but there is that gut brain connection that now can't be denied. And making sure you keep those systems healthy with those good foods is so, so important. So we actually have 3 pediatric offices that refer to our office, the medical offices, these pediatricians. They refer these patients to us because what we do know about ear infections in children is that, according to the literature, about 97% of ear infections are actually caused by viruses. Now, yes, bacterial infections can happen as well. We know this. However, this is why the American Academy of Pediatrics, about a decade ago, chose the watch and wait approach with ear infections, because what they were seeing is that they would continually provide antibiotics for these ear infections, and then it would just cause a cascade of multiple ear infections over and over and over again. And they were just more antibiotics. And it just kind of got to that point where they kind of sat back and they did cultures, they looked at things, and they found that a lot of ear infections will resolve on their own. Of course, if it's bursting or something like that, of course, that's something the pediatrician would have to look at and go, okay, well, maybe an antibiotic is necessary at this point. However, watch and wait is now, again, it was about a decade ago, maybe even longer than that the American Academy of Pediatrics came out with this protocol of watch and wait when it comes to ear infections before they just throw an antibiotic at it. So I thought that was just brilliant. And so what we're having now is we're having pediatricians refer to our office to see these kiddos. So first of all, we want to make sure that the master breaker, the atlas, is holding. And if it's not, we adjust it. And again, with children, depending on their age, we typically don't do films unless there's been sort of traumatic injury to the neck or brain that we need to evaluate that area a little closer. But we typically don't take films any younger than, like, say, 4 or 5. They're not compliant. We can't get them to sit still, but we can do something called a challenge. It's a proprioceptive challenge. This is something that Dr. Julie Meyer Hunt, she actually does the pediatrics course for the upper cervical work. She is in Florida, and she teaches this very, very well. It's a proprioceptive stretch. So we have the child lay on their back, and we check their leg length. Typically, if the atlas is out of alignment, we'll see a pretty decent leg length difference. And what we'll do is we'll just press on one side and see if it actually causes that leg length to change for the better, become nice and even. So we'll check both sides, and whatever side that we push on causes those legs to become even, that's the side we adjust on. We either use an instrument, or there's actually a special pediatric, we call kind of a drop piece. I call it my funny necklace. I put it around my neck. It kind of lays like there's this, like a headpiece, and the baby just sits right there. The mom sits on the floor and holds the child, and they just put their little ear against it. A little headpiece pops up, and I put my finger right here, and it just drops down just real quick. It is very light. Again, there's not a hard force on it at all, but then we check again the leg length and make sure the leg length is nice and even. So we start there. We also want to make sure the eustachian tubes are open. This is one of the main reasons why pediatricians refer to us for this particular technique, not just the upper cervical work. But we open up the eustachian tubes by doing just a really quick tug on the earlobe. This opens up the eustachian tubes. It's something that kind of, with children, their eustachian tubes are still kind of flat, so fluid can build up in there, and that's why they're a little more prone to ear infections. And so what we do is we adjust the ear, and that opens up the eustachian tube to allow things to drain a whole lot better. It's not fun for the child because it does, I'm pulling on their ear really quickly, but they get over it really quick. As soon as they see mom, they hug and crocodile tears are gone. But it really does help kind of drain that area, because you don't want that fluid sitting in there. A lot of times, the pediatrician will send them to us, hey, they've got ear pain. I don't see any active infection in there. But we want you to do this adjustment so we can open up the ears so infection doesn't begin. So sometimes it's even preventative in nature, because a lot of times, even before an infection begins, the patient can start, that child can start to feel pressure build up in the ear. And so therefore we release that pressure, and that aids in, prevention of an actual ear infection. So again, we have pediatricians that refer to us all the time for these issues. And it's really a privilege to work with these pediatricians and the kiddos that they send to us. Every case is different. And, we've had some cases that were a little far gone, and, we sent them back to their pediatrician, and there's been a small handful that have needed the surgery. But, then after that, what do we do after that? After the surgery, do we want to keep up with the chiropractic care, keep the nervous system functioning properly, make sure that Atlas is in alignment? All of that plays into prevention of another issue happening, because sometimes surgery isn't always just one surgery. Sometimes they need, more tubes. Sometimes, all of those things play in. So it's hard to say with each and every patient. But again, we love working with these pediatricians to make sure that these kiddos get the care that they need, because again, it's always about the patient. There is standard process. Again, they've been around since the early 1920s. And they have they call it the purification program. It's not just a gut detox. It's really a whole body detox. And it's for 21 days. And again, a lot of patients are like, oh gosh, 3 weeks. I go, but you know what? You can do anything for 3 weeks. So, what I love about it is it's not one of those detoxes where you eat very little food or you starve yourself or anything like that. You're eating weird things. It's all about feeding the body what it needs. And what I love about it too is it helps people understand maybe what foods they might be sensitive to as well. So it's an elimination diet as well. So it comes with something called SP Complete, which is the protein powder. So, because you don't want to lose muscle mass when you're detoxing, right? You want to make sure you're feeding your body quality protein. Just the plethora of amount of nutrients that are in this protein powder is just astronomical, and it all comes from whole food. They have a whey protein. They have a dairy-free protein. So you're actually looking at, if anybody has any special dietary needs, they actually have, protein powder for them. It also comes with a fiber as well. It's called gastrofiber, which is more of a psyllium-like fiber, or they have the whole food fiber. I try and ask patients, do you have problems with bloating with eating a high fiber diet? If they do, I have them move to the whole food fiber, which is, like a scoop of beet fiber they can put in. That's a little more gentle on the system. The psyllium fiber, the gastrofiber they have is also an excellent product. But I always like to make sure with patients before I recommend either of those. Then they also have something called SP Cleanse. This is where it cleanses the liver, it cleanses the blood, it cleanses the gut, and the all the ingredients in that. Again, you've got like juniper berry, which is another one that's really good. You have, I can't remember all the ingredients in it, but again, it's a very gentle cleanse at this point. You're not looking to run to the bathroom every 20 minutes. It is everything that this program does. It really helps heal the gut, the liver, the kidneys, the blood, everything all at once. So it's not just like a gut cleanse. And then there's one called SP Green Food. You get all the greens in there. You've got your kale, you've got your broccoli, you've got everything in this one particular supplement. So the first 10 days of this program is nothing but fruits and vegetables. Now that kind of makes everybody goes, oh my gosh, what am I going to eat? Well, we really need to kind of make the gut a little bit happier. When we eat protein, especially animal protein, it does take a little bit longer for our guts to digest this. We want to eliminate any hard work our gut has to do, our stomach and our gut has to do. So we take out everything but fresh fruits, vegetables, and lentils are okay, but just fruits and vegetables. So a lot of soup is really good in this. Soups and salads basically is what you'll be eating for the next several days for the first 10 days. We also eliminate, during the whole 21 days, all grains, all legumes, except for lentils, all nuts, as well as soy and dairy. So those are like the 5 main high allergenic foods. So we take out the most allergenic foods just to kind of see how the body does without them. And eggs is another one too. We take out eggs as well, because that's a huge allergenic food. So many people are just off the charts in that one. So we take all those out. And then now days 11 through 21, you add back in your animal proteins, whether it be fish, chicken, beef. Those are probably the biggest ones that people want to add back in. And you add those back in. Again, you're not going to eat a steak. You're going to eat a steak. About 3 ounces is about what the body can digest. But you need those amino acids that are found in that for muscle mass, for brain health, things like that. So that's what we add back into that days 11 through 21. And the supplement protocol goes along with that. So there's a whole process that goes with it. But at the end of that, now this is not a weight loss program by any stretch of the imagination. It's a get healthy program. And a side effect of getting healthy is actually losing some weight as well. So on average, women can lose between 6 and 8 pounds during this first 21 days. Men, well, it's a cruel world. They lose between 15 and 20 pounds. So that's one of the things that, we do see quite often during that time. People feel so good. They've got a lot of energy. That's the cool thing about this. So that's really our baseline detox. We also have a ion detox foot bath as well. And that is something that you can do in our office. So we encourage patients during this time to actually do that as well. And what that is you put your feet in this bath. It's got a little bit of salt in it, a little salt to activate the diode that's in there, which creates negative ions. Negative ions actually help cleanse the body of any sort of free radicals that may be running around in there for detoxification purposes. And a lot of companies say that the detox comes through the feet because you see the water change color. While a little of that happens because our skin is our largest detox organ, what we do see is we see that the majority of the detoxification takes through the Bohr effect. It's called BOHR effect, which is actually through the lungs. So while they're sitting there relaxing, having this ion detox foot bath, they're actually breathing out the toxins, so out of their body. So that's what that we also offer that in our office as well.